mental and physical health each day. Your doctor has requested you have a sleep study to look for problems occurring during sleep. This is likely your first visit to a sleep center. A sleep study involves a polysomnogram, a recording that tells the sleep specialist what kind of sleep you are getting. Many people wonder how they will be able to sleep in a strange room filled with distractions such as technicians and monitoring equipment. You will be pleased to know that most sleep centers have homey, comfortable rooms, more like a motel room than a medical facility. The technical equipment and professionals who record your sleep study are in a separate room. When you arrive at the center, you will be greeted by the sleep technologist who will assist you throughout your study. You will be shown the equipment that will be used and given a chance to ask questions. You will have time to change into night clothes and get ready for bed as you do at home. There may be a waiting period before the technologist applies the sensors for monitoring your sleep activity. During this time, you can read, watch TV, or just relax. During sleep testing, the activities that go on in your body during sleep are monitored by small metal discs called sensors applied to your head and skin with paste, tape, or another adhesive. The ones on your scalp and face measure brainwave activity, eye movement, and muscle tone, all of which are used to determine what stage of sleep you are in. Flexible elastic belts around your chest and abdomen and the sensors at your mouth and nose measure your breathing. A clip on your index finger or earlobe monitors the level of oxygen in your blood and your heart rate. Your sleep may also be videotaped to see what positions you sleep in, whether you move a lot in your sleep, and for the presence of sleep disorders. None of these devices is painful, and all are designed to be as comfortable as possible. The sensors may feel strange on your skin at first, but most people do not find them uncomfortable nor a big distraction in falling asleep. The electrode wires are gathered together in a kind of ponytail behind your head, so that you will be able to roll over and change positions almost as easily as you would at home. In order to understand your sleep and any problems with it, it is important to look at various brain activities and body systems throughout the night. The specific type of study you will have depends on what type of sleep disorder is suspected. A nighttime sleep study provides information on sleep and breathing disorders, such as obstructive sleep apnea or central sleep apnea, nighttime movement disorders, or seizure disorders. Your sleep may be studied during the day as well through a series of naps at 2-hour intervals. This nap study, known as the Multiple Sleep Latency Test, or MSLT, measures daytime sleepiness due to any sleep disorder, especially narcolepsy. After the study, a sleep specialist will review and interpret the records to help you and your doctor understand your specific sleep patterns. The sleep study and its analysis and interpretation are part of a complex process. Specially trained professionals handle the many hours of work that are required to process or score the large amount of information recorded during the study. A sleep specialist with in-depth knowledge of sleep and its disorders then interprets the information. A typical sleep study involves more than 800 pages of data. If a sleep disorder is found, a treatment plan will be made to correct.
I slept much better, I think, initially there, although the mask bothered me until I switched over to the pillows. I did have, it was a number of days, weeks maybe, that every time I go to sleep, I'd have to get used to breathing against or breathing out against that air pressure. After a period of time, I don't know how long, maybe a few weeks, months, I put it on and I never even noticed that anymore. Today when I put it on, I wouldn't notice it. But it's been a very positive thing and I wouldn't go without it.
Your sleep study is an important tool in helping your healthcare professional diagnose and treat any possible sleep disorder. The procedures are painless and an emphasis is put on making your sleep study experience as comfortable as possible. If indicated, you will be assisted in trying a positive airway pressure machine. Treatment can prevent or reverse the serious consequences associated with obstructive sleep apnea. Your sleep study is the first step towards improving your sleep, your health, and the way you feel.
Medication. Are these your medications?
yes.
Okay. Okay. Do you have any pain this evening? No?
A little, not really.
Okay. Has there been any medical changes since you last saw your doctor?
No, nothing.
Do you need to get up before 6 a.m.?
Yeah, my nose. She said, yeah, had a cold.
Do you have to get up before 6 a.m.? Do you need to get up before 6 a.m.?
Yes, I do. Yes.
What time?
About 5:30.
Hang on just a minute.
Yes.
She does need to get up. What time?
Six is fine.
6
is
a.m.?
Mhm.
How are you feeling at the moment? Are you feeling very awake, a little foggy? Foggy, difficult to stay awake.
So-so.
So. Did you feel sleepy today?
Not really.
No. Did you take a nap today?
Yes, I did.
What time of day was that?
Did something out. Then I watched.
Did laundry, then I watched TV.
I washed my clothes. Then I had a little break. And I watched a little bit of TV. Then I took a nap around 1.
1300.
I think it was about
1 o'clock?
about 1.
Okay.
I'm sorry.
1 o'clock.
Does she drink alcohol? Does she drink alcohol?
No. Sometimes, but I stopped.
Not today.
A while ago. Yeah, no, not today.
Did you have anything out of the ordinary happen to you today? Did you have a normal day?
No, nothing happened today.
We have 3 forms with a need of a signature on a couple of them and a date on one, and they have X's where the information is needed.
Okay.
Okay. This right here and there. Right there. And here and here. I have a question. Would it be possible for somebody to stay here till she goes to sleep? Just so we don't
How
have,
long do you think?
well, it'll be somewhere between, between 10 and 10:30. I will try to get her in bed sooner if she's ready to go to bed sooner. I just don't want
Right.
her
Right.
to get excited
Yeah.
and not be able to
Might be better,
communicate with her.
yeah. Is that okay with you? Okay, that's fine.
We have 3 facilities.
Okay.
All private. She has a shower in the morning if she wants.
Hang on just a minute, cause she's looking down and she can't
Okay.
watch us. Let her go ahead and sign that, and then he's from Troy, he's a student interpreter, so.
All right, thank you. Do you have any questions for me?
No, I think I'll be all right.
Okay, your bathroom is completely private. You have a shower in the morning if you want to change your, if you need to take a shower in the morning. You have bathcloths, light switch, emergency switch,
Okay.
only if needed. Okay, you want to put the closed caption on the TV? I believe we